Good afternoon, everyone, and welcome to the virtual training session on counseling for contact elicitation during index testing. Today's facilitator is Dr. Sai Prasad Bhavsar, sir, Deputy Director, Basic Services, Prevention and STD, NACO. We welcome you, sir, for today's session and request you to start the session.
Thank you, madam. Uh, Thank you for the introduction. I'm Dr. Sai Prasad Bhavsar. I'm Deputy Director NACO for Prevention BSD in STI. And I have my full team over here. And on behalf of NACO, I welcome you all again for this session of counseling for contact elicitation during the index testing. So, given the context, we have seen that the index testing campaign has been implemented across the states. We launched this campaign by 15th of April 2024, and it's more than 3 months now that we are here in that we have crossed almost around 60% of the target PLHIV coverage. We foresee that the full coverage will be completed in the next couple of months, but there is a matter of concern, not in terms of coverage but in terms of the quality of client elicitation or the contact elicitation per se. We are seeing that most of the clients that are registered by the counselors in ICTC or ART settings are mostly the spouse and children. But and since they are limiting themselves to spouses and children, the positivity is coming to be very low. We under the campaign need to broaden our perspective in terms of reaching out to the sexual other sexual and nurturing partners also, so that we can identify quality, we can have quality contact elicitation and have a better yield or results. I have a slide which will show you a snapshot of how we are progressing, but the presentation is mostly upon the counseling or the technique that is to be undertaken for uh, uh, contact elicitation. So this is broadly in this presentation. We have invited the SACS level officers because we understand that it to cover so many counselors will be a difficult challenge. We will share you this presentation. We will share you the script of the presentation, a script of contact elicitation, everything with you, so that you can take a down training of all your counselors and ensure that the counseling session that is provided by the counselors to the PLHIV are productive. You can also convert it into a regional languages. The presentation can be converted to the regional languages. Maybe if not the presentation, the contact elicitation script can be converted into regional languages, so that counselor can interact in a better way, and understand in the better way, and interact in a better with the PLHI for the contact elicitation. So I move ahead in terms of PPT. The content is based upon the introduction. I'll briefly introduce what is the index testing, what is the campaign per se, challenges and what are the challenges and barriers in contact elicitation by the counselors that we have seen based upon the study. What are the I will briefly give you uh, brief insight on the brief motivational interview and have a demonstration on the counseling for the contact elicitation. So next slide, please. Okay. So broadly, index testing guidelines have been issued. It's not it's their side. So broadly, index testing guidelines have been issued to every one of you, and the training modules on index testing have been also given to you. Training modules on counseling have been given to you. So again, coming on to the index testing, we have seen that index testing is not limited to the household testing, principally not limited to the spouse and the biological children, but it includes, in addition to the spouses and the biological children, which are less than 19 years of age, we also have sexual partners and needle sharing partners. In case the index is less than 19 years of age, their contacts, if a child is less than 19-year-old and he is the index client for you, so you will try to reach out to their biological mother. Biological father is the if the child's mother is HIV positive, if she is deceased or her status is unknown, is unknown, you will reach out to their biological siblings who is less than 19 years of age, and then sexual and needle sharing partners if the history is elicited upon the taking the history, because not necessarily that the child who is less than 19 years of age will only have contacts in terms of household contacts. He may also have give history of sexual or needle sharing partner if there are any. So the index client are broadly newly diagnosed HIV people living with HIV, known positive person yet to be offered index testing, who are under the program taking the treatment, alive on treatment, but are yet to be offered index testing. This also includes miss cases, LFU cases, interrupted treatment cases, the PLHIV with the unsuppressed viral load, the PLHIV with the reporting a change in the relationship status. If they have a new partner that they are into a relationship, they should be offered index testing, and the PLHIV eligible for repeat index testing. So repeat index testing principally means if the PLHIV is offered index testing in a duration more than 6 months, then he has to be offered the index testing irrespective of the previous testing. Next slide, please. So index testing strategy have been implemented in the campaign mode. Let us be very clear about this, that this is a campaign mode and it has limited shelf life. But per se as a strategy, it's a long term strategy. It's not a very old strategy. We have been implementing under the program since last couple of years, but we need to be more specific. We need to be more focused in terms of how to implement this strategy at various levels, various facilities, and also how to monitor this strategy implementation at the state and the DAPCO level. So campaign has a limited shelf life of maybe 5 to 6 months, but the strategy have a long shelf life in years to come, which will be there into the program. The communication have been shared from the desk of ASNDG NACO, and the campaign have been implemented from 15th April to 15th October 2024. Guidelines, as I said earlier, have been shared with you, and we are undertaking regular review meetings with all of you. And we also understand that you all have been taking a regular review meeting with the DAPCOs and the concerned field level staff to monitor the progress. Training and sensitization is undergoing. Almost 50% of the counselors have been trained on the 5-day training module of the counselors. The 5-day training module do cover the index testing in details. It has a 2-hour long session. But since this is a new strategy, we foresee that you give another orientation or detailed orientation to all the counselors on various aspects of the index testing, principally the contact elucidation that we are talking in our current session. So you keep on training and sensitizing your field level staff on a regular basis, and just not limit yourself to regularly review them on the progress of the campaign. Next slide, please. So as you have seen, as I have said earlier, almost 10 lakh PLHA have been reached through the campaign. 10 lakhs out of these 10 lakhs PLHIV, almost 9 lakhs contacts have been elicited. So 10 lakhs PLHIV have given us almost around 9 lakhs cases. Out of those 9 lakhs cases, almost 2,72,595 tested cases have been tested for HIV. So we have a long way to go in terms of testing. Almost the testing percentage is in the terms of 50% of the eligible contacts, and out of 5 lakhs that are eligible, 2,72,000 have been tested with the yield of around 11,000 cases. So in the last 2 months of the intensive campaign across the state, we have identified almost 11,000 cases. And let me tell you this very upfront, that on an average, on a month-on-month basis, basis, we are identifying 15,000 new cases on a regular basis. But this campaign have additionally identified 11,000 cases, and this campaign is not even half reached. There is a lot of scope in terms of identifying new cases. So we all want you to understand that we have not even reached half of the client, and there are almost 11,000 cases that we have already identified, and scope is yet to be saturated. The next part of the slide, or maybe on the right hand of the side, is actually the pattern of the index testing that is being implemented. Blue part is index testing being undertaken in the spouse and children, and the orange part is actually the index testing undertaken in sexual and engineering partner. ART center we have seen are mostly engaged in spouse and children testing, where 97% index testing offered to the spouse and children. Only 3% are the cases where they have identified sexual and injecting partners. ICDC have done a bit better compared to ART center, where 81% are spouses and children, 19% are the sexual and other sexual and injecting partners. TR settings, we all understand that they are mostly having partners and injecting partners and sexual partners. So they have a better, we understand that we'll get a better yield in terms of reaching out to sexual and injecting partners in the TI and OSC settings. But our chunk of our PLHIV are into the ICDC and ART centers. Like in the ICDC, last year we have identified almost 1.75 lakhs of PLHIV. So this 1.75 lakhs PLHIV are the target for the ICDCs to reach out to the for offering the assessing. Whereas in ART center we have almost around 18 lakhs PLHIV, and out of 18 lakhs, if we take out 1.75 lakhs that are reached by ICDC, almost 16.5 lakhs PLHIV are to be reached to the ART center. So chunk of the PLHIV are to be reached through ICDC and ART, and we have to understand that reaching out to the other sexual and injecting partners is the only critical way of actually creating an impact of this campaign. Next slide, please. Okay, see, so we have tried to see what are the major challenges faced by the counselors, what are the issue in terms of reaching out to the spouses and partner. There are many issues. Clients are not ready to share the details of their sexual and injecting partners for the fear of disclosure of their HIV positive status to their partners. They don't even remember, maybe HRG, PLHIV, or maybe PLHIV don't remember their sexual injecting partners since they are on treatment for a long time, and from a long time they are not in contact with their sexual injecting partners. They are afraid of approaching the contacts of the index client while maintaining the confidentiality of the index client. They have a sense of apprehension while sharing the information about the partners to the counselor, that once they will be reached, the confidentiality will be breached. So there are other things also which are highlighted by the counselor in their interviews. It was mentioned that it is what do we call inverted commas, it is like it is when the husband is on medication and does not disclose it with his wife, and finally when she come to the center, which is where she is tested HIV positive, she is sobbing away, and such is one such a challenging situation to handle her and make her understand the importance of indexing. The priority remains on putting on making her understand the positive status, putting them her on treatment, and then next step goes on to the partner elicitation. So these are the challenges. Second is one case was that the pregnant woman where wife tested positive, however the husband is negative. This is a challenging situation where it is difficult to reveal the report to the husband, and also fact that the wife is pregnant and can be stressful for her. This stress is principally one stress is principally that the husband will be informed of the HIV status for him to be reached out to the HIV testing, and second, the stress is about the passing the virus to the child who is going to be born by this through this mother. Then a third is about a boy who was having multiple sexual partners and engaging sexual activity repeatedly. He was not listening to the counselor on the repeated counseling session, and further on, he was not coming to the facility also for treatment. The counselor was told not to engage in high risk behavior, but he was not listening to me. So on one hand, where he knows his HIV positive status, he's not coming to the ART center, he's not coming to the treatment, he's not virally suppressed. On the other hand, he is also engaging in high risk behavior, spreading the HIV infection to the other partners. Is not listening also to curb or to behavioral change communication being undertaken by the counselors in the ART settings. So then reaching out to him for the index testing is even the remote possibility. So there are many challenging situations. We have Each client is unique, and each client poses a unique challenge in terms of clients elicitation. It is as good as dealing each patient separately. So next slide please. So we have a pop-up quiz for you. I request uh, Divya ji to pop up the quiz, and I request the participant to give their responses on the quiz. Over to you, Divya ji.
Sir, the quiz is displayed on the screen and participants are requested to please choose their answers. You have multiple answers in this question.
So the question is, how much time or counseling sessions are required to elicit contacts effectively? We can select multiple choices. You can select two, three, four, everyone. So I request you all to select as much as you feel are the positive answers. So Divyaji, let us know when to stop the quiz.
Yes, sir. Just we'll wait for another 10 seconds. There are around 180 responses, so I request all the participants to please put in their responses.
Okay, so going ahead with the responses that we have, yes, three or more counseling sessions are required for reaching out to the or eliciting the contacts effectively. So you all understand that yes, the counseling is a tough task, and we all have given you the guidance that after each session of contact elicitation, we generally give a gap of maybe 15 days to initiate another round of contact elicitation. So on an average, it takes more than 45 days for an effective counseling and the effective contact elicitation. Um, in terms of how much time is required, more number of participants have said 6 months or more, but on an average what we understand is 2 months or more is the time, but we go by the public poll that you require the 6 months or more of the client elicitation. So you all understand that, uh, please understand that the campaign have been initiated. It has a limited shelf life of 6 months. It's a time that is good enough to reach out to the PLHIV and elicit the contacts, but it's not limited actually. It's a ongoing strategy. The clients are to be counseled maybe for 2 to 3 sessions, even more than that. And for an effective counseling, it takes almost two months or more for contact elicitation. Uh, it needs patient. Maybe we all are driving our counselors to reach out to the clients, but yet yes, it's a tough task. We need to be judicious and patient also in terms of giving our counselors sufficient time to reach out to them. But yet yes, while we give the time, if it's sufficient time, we also need to ensure that the quality contact elicitation is actually there. So it is not that the spouse and partner, spouse and biological children are the ones that we foresee. We also foresee that the partner elicitation in terms of sexual and needle sharing partner are also elicited in this campaign. It is a tough task reaching out to the contacts, or maybe having a recall bias of the clients who are more than 6 months or more than 1 month or 1 year or maybe more than 2 year will be difficult challenge. Knowing the names or remembering the names or the contact details will be a challenge, but we all have to uh, get above all these challenges, take the case things scenarios case by case, and reach out to the PLHIV. Next slide, please. Next slide, please. Okay, this is a case study that we have had from a project in the state of Mizoram. A client named Kimi. She was 16-year-old from a small village in Kolasat district. She met a young man of 20, a guy of 26-year-old, and who came to visit his friend in this inner village, where they eloped to a different district. Actually, this boyfriend was injecting drug user. So after a brief period, Kim was separated, and Kim visited an ICDC where she was pregnant. Uh, while she gave the sample for testing, she left without the collecting the report after certain apprehension of sense that she might be tested positive. But since she was pregnant, she was tested again and was found to be HIV positive. She was reluctant to The counselor was reluctant to ask the sexual partner, as she was not living with the spouse. She didn't disclose she has a spouse, and also it was a difficult scenario of eliciting the partner. But after 3-4 months of the counseling, she brought her current boyfriend, where who was tested HIV positive. So the current boyfriend who was living with us was HIV positive. Her ex-boyfriend was also contacted, from where she have got the HIV virus. The ex-boyfriend's girlfriend was also tested HIV positive. So this all scenario in the last 3-4 months that we foresee, out of the one index, we have identified almost two to three more clients who were HIV positive, but the child who was born was negative, out of the EVTHS interventions that we have. So, um, so the entire process took around 6 months. That you all told that 6 months was the time that, yes, we have seen that this particular case took around 6 months for exact contact elicitation, and the client elicitation doesn't end here. The ex-boyfriend, the boyfriend's girlfriend, and everyone is a new index, and reaching out to the every new PLHIV is a new cycle in its own perspective, and a new wave per se for each of the clients. So the client or the wave doesn't end. It starts with the new PLHIV that we identify, and it's a continuous process. So you all have to make this understand to all your counselors that just identifying one index positive will not end your work, but then again putting that patient on treatment being the priority, and then reaching out to the contacts is and initiating the second wave through that PLHIV is the priority. Next. So, prerequisite for the effective counseling are privacy during the counseling, which contribute to the higher partner elicitation. You should have a private counseling room. Sufficient audio visual privacy should be there. Another prerequisite is that enabling the PLHIV to know that there are different kinds of methods to reach out to the partner. We all have the details about the client referral, provider referral, contract referral, or dual referral. These all strategies are all available into the guidelines that we have shared with you. Client referral is principally where the client, the PLHIV himself or herself, reaches out to their own partners. Provider referral is where the client empowers the provider to the consent to reach out to their partners. The contract referral is the two-step process, where first a contract is between the client and the provider, where the client will first try to reach out to the partner, and after sufficient duration of time, if the client doesn't reach out, the provider reaches out to the partner. So, and dual referral is it's not like a contract where first the client goes, and then if the client doesn't goes, then the provider goes. Dual referral is the situation where the client and the provider, both of them, sit together with the partner, sexual or needle sharing partner, to provide them index testing. So these are different approaches, different strategies. You all have different strategies available with you. Please go through them before you provide the training to the counselors. The next is good IC material to motivate the English testing to share the client detail. The IC material have been shared by the IC division I hope you will have undertaken the printing of this IC material and provide this IC material to the ICDC, ART, DSRC, TI settings, and the OSS center for their replication. Next slide, please. So this was about a brief motivational interview. Next slide. Okay, so we again have a pop-up quiz. So Divya ji, over to you for this quiz. If you can share the quiz, I'll request the participant to give their answers. Maybe we can have 1 minute 30 seconds for this quiz.
Sure, sir.
So I'll read out to you. At ART Center, ABC, Renu was referred for HIV treatment when she was admitted for a cataract surgery and diagnosed with HIV positive at the ICDC. So first, Renu was diagnosed with. Renu wanted to undergo a cataract surgery. So it is, but obvious that the Renu is a old patient which is suffering from cataract. For cataract surgery, the surgeon referred for the HIV testing. She was diagnosed HIV positive, and since she was confirmed HIV positive, she was referred to ART for treatment. While offering the index testing, the counselor realized that Renu is also a widow. She's old, she's a widow. There was another case. So this is a scenario where Renu is a widow and a old case. Another scenario, there is another case where another ICDC one day Shantaram, who was also an old patient, 62-year-old man who was tested HIV positive during routine health checkup. So what do you think? Which case need HIV testing? So I'll end the poll from here. We have got good responses in terms of if there are any, I'll give 10 seconds more. 5 seconds. Okay. So 88% percent of patient or the respondents responded that both the cases of Renu and Shantaram are to be offered the index testing. Uh, So yes, in both the cases, even though the cases are old, one is the widow cases. We have to offer index testing to both the cases and try to elicit the partners from both them. They may be spouses. Biological children less than 19 years of age is a less probability, and then sexual and needle sharing partners of these cases. So, but there are a few who still said that no need to offer index testing to either of them. So, no, index testing has to be offered to both of them. Next slide, please. So, difficult cases as reported by the counselors during informal interviews, like the MSMs, are the difficult cases. They don't easily reveal their partners. They have multiple partners. Mostly they have multiple partners, sequential or maybe concurrent partners. IDUs have large number of partners. They don't remember. They don't identify. Old patients, we presume they might not be having multiple partners. Widow, it is being a challenging situation. Pregnant woman, social scenario in terms of partner elicitation. Adolescents, where parents are negative. Adolescents are difficult to. You all are aware that adolescents are difficult to handle. You'll have children who are in adolescent age group, and then and partner elicitation is even more difficult out of fear of disclosure to their parents. Casual partners, dating apps, the partners identified through dating apps are difficult to, and the dark room partners, where actually the client is unaware of whom he had sexual encounter with. So these are the difficult cases. We need to identify such cases and give special priority or prioritization in terms of providing the intense counseling to this set of clients to elicit the partners from them. Next slide, please. So we have a demonstration of contract illustration in the case of a widower. Divaji, if you can upload the demonstration.
हाँ, आशिक आ गया। आओ आओ आओ, आइए आइए। अरे बहुत अच्छा लगा आप आया। कल आपसे बात हुआ, मैं सोचा आप आएगा कि नहीं आएगा, बस बहुत अच्छा लगा आपने आया बोला तो आ गया।
नहीं, आपने बोला था तो आना पड़ा।
हाँ
तो जरूरी भी था इसलिए।
सही है सही है। पानी पीना है?
नहीं, पानी अभी
पी के आया ना, ठीक है। बाकी कैसे है अभी, मेडिसिन वगैरह सब ले रहा है आप?
हाँ, चालू हो गया मेडिसिन में ले रहा हूँ रेगुलर।
कोई तो प्रॉब्लम नहीं है अभी?
कुछ
हाँ, जो हम लोग
शुरू में प्रॉब्लम हुआ था।
हाँ,
फिर डॉक्टर ने कुछ
डॉक्टर साहब का
चेंज किया, अभी ठीक है,
अभी प्रॉब्लम नहीं है ना। अच्छा, तब तो बहुत अच्छा है, फिर आपका कोई इश्यू भी नहीं है ना। बाकी घर में भी सब ठीक है?
ठीक है सर।
ठीक है, ओके ग्रेट। अच्छा, एक चीज़ में आपको बुलाने का एक मकसद था, आपको शायद याद है जब हमने आपने पहली बार आया था ना टेस्ट करने के लिए, तो उस वक्त में हम लोग जब बात कर रहा था तो अब एक चीज़ मैंने आपको बोला कि अगर आप रिजल्ट अगर निगेटिव आया तो कोई प्रॉब्लम ही नहीं है ना, और पॉजिटिव आने से भी कोई प्रॉब्लम नहीं है, आपने मेडिसिन शुरू कर दिया। बट क्योंकि हम लोग जो बात कर रहा था कि ये बीमारी HIV बीमारी कैसे फैलता है, तो हम एक चीज़ आपको बोला था कि अगर आपने किसी का साथ अनप्रोटेक्टेड सेक्स किया होगा तो उससे भी आपका पास आ सकता है या आपसे उनका पास जा सकता है। अगर कभी अपने नीडल सिरिंज से इंजेक्शन लिया और उसी से नीडल सिरिंज को किसी का साथ यूज़ किया, दूसरे ने यूज़ किया, या दूसरे का नीडल सिरिंज आपने यूज़ किया, तो आपका पास आ सकता है। तो आपने तो बोला कि आप नीडल सिरिंज यूज़ नहीं करता है, तो अभी मैं वही जानना चाहता था कि अगर कोई आपका बीवी है, अगर आपका अभी वाइफ है।
नहीं, आपको मालूम है उस दिन बोला।
हाँ अच्छा, मैं भूल गया था, सॉरी। हाँ,
मेरा वाइफ एक्सट्रा हो गया 4-5 साल, ऑलमोस्ट 5 इयर्स, 4-5 साल होने वाला।
5 साल आप अकेले ही है। अच्छा, आपको कोई बच्चा है क्या?
बच्चा है, बड़ा है, सब
बच्चा है ना,
कॉलेज में पढ़ रहा है।
कॉलेज में पढ़ रहा है, और तब तो ठीक ही है। छोटा बच्चा कोई है? 9-10 साल, 15 साल नहीं है ना, ओके। तो बीबी का कुछ हुआ था, आपने टेस्ट वगैरह किया था क्या कभी, और मेडिसिन डॉक्टर के पास लाया था?
हाँ, ऐसे तो टेस्ट मतलब क्या सर?
अभी HIV कुछ टेस्ट हुआ था?
हुआ था एक बार, लास्ट हुआ था जब उनका ऑपरेशन हुआ था।
हाँ,
मेरा बीबी एक्चुअली में हार्ट अटैक से गुजरा, उनका हार्ट का प्रॉब्लम था।
अच्छा,
तो एक बार ऑपरेशन हुआ था, तब वो उस वक्त उनका HIV टेस्ट करने के लिए भी कहा। बीवी का कोई HIV
टेस्ट नहीं था ना?
नेगेटिव। अच्छा,
तो एक चीज़ आप देखो, मैं ये नहीं बोलता हूँ कि आप पर्सनली मत लेना, क्योंकि ये बीमारी ऐसे आता है, तो इसके लिए अगर आपका पास आया, आपका बीवी का पास नहीं है, तो अभी आपका पास आया है, तो देयर आर 2-4 ही रास्ता है, राइट। एक मैंने बोला था कि आपने ब्लड लिया था किसी से, लाइसेंस ब्लड बैंक नहीं होने से, या किसी का साथ अपने सेक्स करने से, पता ही है ना। तो उस दिन मैंने बोला था कैसे HIV फैलता है, 4 रास्ता है ना जी। एक है अगर आपने किसी से ब्लड लिया, लाइसेंस ब्लड बैंक नहीं है, तो उसमें अगर ब्लड से अगर खून में HIV तो आ सकता है। दूसरा था अगर कोई ड्रग्स ले रहा है इंजेक्शन शेयरिंग से, नीडल से, उसी नीडल से इसको आपने फिर यूज़ किया तो आपका पास आ सकता है। या फिर माँ अगर HIV पॉजिटिव है बच्चा को अगर हॉस्पिटल में डिलीवरी नहीं हुआ तो बच्चा को हो सकता है। और जो है सेक्स का जरिया, अनप्रोटेक्टेड सेक्स मतलब अपने किसी का साथ जान पहचान नहीं है उसका साथ अपने कॉन्डम बिना कॉन्डम का सेक्स किया तो भी आ सकता है। अभी आपने तो बोला था कि कभी आपने ड्रग्स नहीं लिया, राइट? नहीं, कभी भी तो आपने ब्लड भी नहीं लिया।
सब ब्लड लेने की जरूरत नहीं,
ब्लड भी लेने का जरूरत नहीं पड़ा,
अभी तक नहीं पड़ा।
अभी देखिए एक ही चीज है जहाँ से आप खा सकता है, वो है सेक्सुअल रूप से, है कि नहीं? तो आपको आप थोड़ा दिमाग लगा देखिए, कभी आपको याद आ रहा है कि किसी का साथ अपने जौन संपर्क किया हो या किसी का साथ अपने सेक्स किया था?
नहीं सर, अभी 55 साल का हो गया, क्या सेक्स सर, अभी तो ऐसा कुछ है नहीं।
हाँ नहीं, आई एग्री, मैं आपको वो ऐसा नहीं बोल रहा हूँ कि आप कर ही रहे हैं, किया है, ऐसा भी नहीं बोल रहा हूँ, बट लेकिन आप एक चीज़ ध्यान दीजिए, कैसे ही चाहिए करता है, राइट? तो आपने ना ब्लड लिया कहीं से कभी, ना आपने नीडल सिरिंज से इंजेक्शन लिया, ना आपका बीबी चाहिए पॉजिटिव नहीं था, है ना? आपने बोला था ना नहीं था। तो अभी अगर बीमारी आना है तो कभी ना कहीं आपको शायद, अब थोड़ा सोचने से, शायद आपने किसी के साथ, शायद कभी भी किसी के साथ ऐसा हो सकता है, नहीं तो कैसे आएगा? मैं आपका गलत नहीं बोल रहा हूँ, किसी का साथ भी हो सकता है ऐसा, ठीक है? अभी मैं भी इतना हूँ नहीं, मेरा भी कभी मन जाग सकता है, कुछ भी हो सकता है, कभी ऐसा सिचुएशन आ गया तो आप थोड़ा सोचिए कि
हो सकता है। सर एक बार तो मैं गया था, है सर सेक्सुअल संपर्क रहा है मेरा, पता नहीं रेड लाइट एरिया जो बोलता है ना सर,
रेड लाइट एरिया,
मेरा बीवी का गुजरने का था। तो वहाँ पे तो मैं गया था सर, वहाँ से पता नहीं हो सकता है।
आप गिल्टी मत फील कीजिए कि ऐसा नहीं है, कभी करने का कभी आपका गूगल है तो आपने किया है, बायोलॉजिकल नीड जैसे ही है,
बोलना नहीं चाहता सर, ये सब फिर खुला हो जाएगा।
अभी नहीं बोलूँगा, आप एक चीज़ याद रखिएगा, जो भी हमारा पास डिस्कशन हो रहा है, बातचीत हो रहा है ना, ये पूरा कॉन्फिडेंशियल रहेगा, ये आपका और मेरा बीच में रहेगा और ये 4 दीवारी का अंदर ही रहेगा।
इससे भी हो गया बोल के अगर बच्चा लोग को मालूम होगा,
एकदम नहीं होगा,
किसी को मालूम हो गया तो ऐसे ही बदनाम हो जाएगा।
आप एकदम चिंता मत कीजिए, आप और मेरा ये चीज़ है, आप अच्छा से मेडिसिन खाइएगा, कुछ नहीं होगा, ठीक है? लेकिन अगर ये जो लेडी है जिसके पास आपने गया, उसका पास एक ही बार गया ना, कभी कभार
जाता है सर,
आप जाता है ना?
मेरा बीवी के गुजरने के बाद कुछ साल बाद मैं जाना शुरू किया सर,
जाना शुरू किया,
अब जाता
ठीक है। तो देखिए, HIV आपका हुआ है, आप अभी मेडिसिन लोगे, आप सही रहोगे, उसी तरह का वो लेडी भी या वो जो ये लेडी है, उनको भी अगर हम लोग टेस्ट कर सकते हैं तो उनका भी पॉजिटिव है कि नहीं वो निकल जाएगा, और अगर पॉजिटिव हो गया तो उसको भी हम लोग ट्रीटमेंट दे सकता है।
ऐसा बोलेगा सर जाके, फिर तो वो बोलेगा कि मेरा वजह से ही हो गया है, ऐसे गाली देगा।
चिंता ही मत करो, हम लोग अलग अलग तरीके से सोच सकते हैं। देखो, एक तरीका है कि आप किसी तरीके से उनका साथ बातचीत करके आप उनको समझा के यहाँ पे लेके आ सकता है, हम उसका टेस्ट करेंगे। दूसरा एक चीज़ है, अगर आप वो नहीं कर पाया तो हम दोनों भी जाके उनका साथ बातचीत करके कहीं ना किसी तरीके से उसको समझा के टेस्ट कर सकते हैं। या फिर आप चाहता है कि नहीं, आप पूरा का पूरा ये उसमें घुसना नहीं चाहता है, आप अगर मुझे फ़ोन नंबर दे दिया या एड्रेस दे दिया तो मैं डायरेक्टली उनको कांटेक्ट कर सकता हूँ, विदाउट कोई इन्फॉर्मेशन, आपका इन्फॉर्मेशन नहीं दे के भी कर सकता हूँ, ठीक है? इसमें से कुछ भी आपको लगता है तो हम उसी हिसाब से कर सकते हैं।
ठीक है सर, एड्रेस दे देगा सर आपको, उनका नाम
आप एड्रेस दे देगा,
बता देगा सर आपको।
अच्छा,
लेकिन मेरे बारे में कुछ नहीं,
आपके बारे में नहीं, तो मैं बात कर सकता हूँ, है ना?
हाँ सर,
आपका कोई इशू नहीं है,
यहाँ पर अगर कुछ
आपको कॉन्फिडेंशियल रहेगा।
हाँ, मेरा कुछ नहीं आना चाहिए,
नहीं आएगा,
मेरा कुछ नहीं आएगा, मेरा लाइफ
ये तो आप चिंता ही मत करो, मुझे भी पता है, अगर मैं आपका जगह में होता तो वही चीज़ मेरा भी दिमाग में रहता, राइट? तो बहुत सही बोला आपने, आपका पूरा ये ध्यान रखा जाएगा। मैं लिख लूँ अभी आपका? हाँ, ओके, ठीक है।
नाम बताना ना आपको?
हाँ, मैं इधर ही रहेगा, किसी का पास नहीं जाएगा, बोलो आपका।
So thank you, Divya, for this session. So I would have wished that I would have interactive sessions with all of you, but it's difficult. We have more than 400 participants now, so one-to-one interaction might be very difficult to everyone. So this is mostly a one-side discussion with you all. As you said, as I said, we said earlier, the counselor tried to give information in terms of route of transmission. The client was in denial, but he made to him to understand that yes, there must be some risk that the virus got into you. It is like either through some route, maybe sexual injection, might not in the recent past, but the but some distant past also you might have had some sexual exposure. So partner elicitation was important. Even though the client was a widow, uh, that client did had some um, uh, risk exposure. So he tried to empower him with the knowledge, he tried to empower him with the support, he tried to be empathetic, he tried to listen to the client, and then gave him the required knowledge and support in terms of reaching out to the partner. So we can go back to the presentation. Yeah, next slide please. So these are the brief motivational interviewing. So motivational interviewing is a tool which help the clients or the patient to increase both their desire to change and their belief that they can actually uh, uh, make the change. So these are motivational interviewing. Motivational interviews you have seen many online or maybe on TVs also. They try to create that desire, burning desire, and then believing that yes, the change can be brought. So brief motivational interview is an adaptation which applies in the healthcare settings or a clinical environment where competing needs for the prevention require a rapid patient-centric interaction to promote healthy behavior. So we have a huge client load. We need to be brief in terms of providing the motivational interview, specific to the point that we want to provide, and then need-based support being provided to the client uh, for the index testing. Next. So, brief motivational interviewing strategy is supported on the four pillars: open-ended, providing the client with the open-ended questions, and second is giving the affirmative statement, reflecting the reflective listening to what the client have said, and the fourth is summarizing the conversation. So, I'll have each one of the pillar will be explained in detail in the next few slides. Next, please. So to begin with, we ask the permission to the client to talk about the index testing, and upon the permission or the consent of engaging into the discussion on the index testing, only the client are more likely to engage and agree upfront onto the on the roadmap or the way forward for the index testing. So the first pillar is use open-ended question to elicit information from the client on the perceived challenges or barriers to index testing. Immediately, the patient will not be giving you the upfront information. Ki I have this many partners or this many things. So there will be challenges. He'll be hesitating. He'll be having some apprehension. So we'll have to assess the client's challenges and barriers with the index testing, specifically in naming or informing the partners. Maybe they are married, and in the life marriage they have other partners also. There might be some logistical concerns in terms they are no longer in contact with the partner. Maybe they don't remember the contact numbers, etc., or emotional parameters such as not ready to deal with the diagnosis or disclose their status to the partner. So the examples of an open-ended question in terms of engaging, what concerns you have about telling your partner about the need to get an HIV test. So we need to ask them, not closed-ended questions. We need to open up in terms of what they ask them to speak more with a single question of what are your concerns. So whatever they say or affrontly they come up with their issues or barriers, we need to address them, or build up the mitigation strategy to the issues that they are raising in front of us about the index testing. Next slide, please. So while we engage in the discussions, use open-ended questions to engage the patient more. We use affirmative statement also to normalize the client challenge. He is already apprehensive actually, so we'll have to make him realize that he is not the only person. We have to make him understand that there are a lot of people who have difficulty in telling the partners about their need to take the HIV test. You are not the only person. A lot of people face challenges. We also understand that you also face challenges. You'll have certain limitation or apprehensions while you reach out to your partner to tell them that yes, you need to get HIV tested, or in fact apprehension about the naming their partner also. So they are not quite sure about how to tell their partner, especially partners you may not speak to anymore. So reaching out to the partner who are briefly or were in contact in the past, or even a difficult task. So you'll have to make them normalize the counselor has to make them understand that this is a normal thing, and it's not a thing that is happening alone with you. And while we discuss with the client, the third strategy is reflection, reflective listening. Reflect back what the client tells to you to show that you have understood actually. So once we try to understand, while we give some reflections of, okay, you try to tell me that this and these things are actually you want to tell me about your issues and challenges. Am I correct in understanding what you are trying to tell me? So yes, when you reflect back upon what he have tried to tell you, you make him understand that you are actually empathetic and listening to that client. So he also feels that yes, there is someone in this world who is actually trying to listen to me. He is actually a PLHIV is actually a person where he's or upfront he's not having a lot of psychosocial support. So the counselor can give that listening ear and giving a reflection about their discussion to the client, making him understand that yes, I am trying to understand what you are trying to tell me. Next. Reinforce the client's commitment to take positive steps for their health and the health of the others. Uh, we can use affirmative sentences like, it takes courage to face your HIV diagnosis and help others to know theirs also. So it is, I know that it is hard to tell your family you are HIV positive, and first of all, it is courageous to accept your HIV positive status and know that yes, you are HIV positive and you have to live that life. But above that, you have to tell your family members also to gather the psychosocial support, which will feel you better. And once you get their support, and then later on to reach out to the partners also that you think have have had the contact with you, to let them know that they need to get tested for HIV. So that's all. That's the strategy for interviewing the client and summarizing the conversation and the client's plan for notifying their partner. So while during the discussion he tried to take out the information about the client, we also try to plan the way, or plan the way to reach out to their partner for notifying their need for HIV testing. For example, the sentence to review, you will tell your partner about your HIV on the coming Sunday. Remember to do it just like we practice. You will also bring your daughter to your next ART appointment so that we can test her for the HIV. I am here to help you if you need so. So this is about closing the discussion with the client about the identifying various ways. We have identified 4 ways of reaching out the partners. You can devise or identify any one of the way which is convenient for the partner to reach out to the convenient for the client to reach out to their partner, and bring them to the center for HIV testing. Next slide, please. So this is about all about affirmative clients' autonomy and capacity for self-direction. In the end, please understand that this process are all voluntary. It's not a compulsion. It's not directive. You have to understand that in the end, it is patient's autonomy to get engaged into this conversation. Increase the client awareness about the testing, exploring and resolving the ambivalence and barriers about naming the contact, and engaging to encourage the behavior change. And listening is the forefront strategy to engage. the most important thing is to going back into the history, which does not limit ourselves to go back into the recent past of 1 year or so. You can start with the latest episode of sharing or sexual encounter, and then go backwards in the duration to identify the x number of partners we have been having sexual encounters or the needle sharing, in addition to the elicitation of the household contacts. So there is no limit in going back in time to understand the exposure. Next slide, please. So we have a demonstration of contact elicitation in the case of an MSM client. Next, please.
सचिन जी कैसे हैं? एकदम मस्त मस्त ना, बहुत अच्छा लगा आप आया। अब सही टाइम में आया, 10 बजे बोल दिया, 10 बजे नहीं आपने आया। निकाल एक के लिए वो वेट कर रहा था, एक पेशेंट को बुलाया था 10 बजे तक, मैंने 2 बजे तक वेट किया, आया ही नहीं। बट दिस इज वेरी गुड दैट आपने पूरा टाइम का ये रखा।
आपने बोला था मतलब
बहुत 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 धन्यवाद आपको। अच्छा, मैं आपको बुलाने का एक मकसद था कि आप जब पहले बार आया था मेरे पास, याद है आपको? जब हम लोगों ने टेस्ट के लिए आप आया था, तो हम लोगों ने जब टेस्ट किया, जब बातचीत किया, थोड़ा आपसे जानकारी लेने की कोशिश किया, तो मैंने बोला था कि एक इंडेक्स टेस्टिंग बोल के कुछ एक चीज़ है जिसमें हमारा, अगर हम पॉजिटिव आते हैं तो हमारे पार्टनर को भी टेस्ट करना जरूरी है। तो उसी सिलसिले में थोड़ा बात करना था आपसे। तो आपका तो वाइफ है ना?
हाँ।
अच्छा, कि शादी कर लिया आपने?
हाँ, शादी कर लिया।
शादी कर लिया ना, ठीक है। बच्चा नहीं है, ट्राई नहीं किया बच्चे के लिए? अच्छा, तो कुछ प्रॉब्लम तो नहीं है, कुछ इशू है? ठीक है, मैं बताना नहीं चाहता तो मैं नॉट फोर्स यू, बट लेकिन एक बार, क्योंकि एज यू नो आपका पॉजिटिव आया है ना, तो आपका बीबी को भी एक बार टेस्ट करना ज़रूरी है। तो मेरा तरफ से यही राय होगा कि आप अगर अपना बीबी को भी लेके आके टेस्ट करते तो अच्छा होता।
तो बेबी का टेस्ट एक्चुअली 2-3 महीने पहले हुआ था।
कैसे?
एक्चुअली उसका फ्रैक्चर हो गया था हाथ को, तो ऑपरेशन किया था, तो सारे टेस्ट कर लिए थे, तो अच्छा, तब सारे नेगेटिव आए थे।
अच्छा, ठीक है, तब तो अच्छा ही है। बट फिर भी एज ए प्रिकॉशन नो, हम लोग 3 महीना बाद एक बार फिर टेस्ट कर सकते हैं। विंडो पीरियड में भी रह सकता है, ऐसा है, होता है, तो 3 महीना बाद आप लाने से ठीक है। अच्छा, देखिए ऐसा होता है, ठीक है, बहुत लोग ऐसा है जिसका अट्रैक्शन लड़की में नहीं है, लड़का में भी है। तो ऐसा कुछ आपका साथ हुआ है क्या? आप बोलना नहीं चाहते, कोई प्रॉब्लम नहीं है, लेकिन ऐसा होता है लोगों को। ऐसा नहीं है कि अननेचुरल है, ये है, ऐसा नहीं है। तो आप मुझे बोल सकता है, अगर किसी लड़का का साथ आपको अच्छा लगता है, उनका साथ कुछ रिलेशनशिप कभी हुआ है, नहीं तो कहीं ना कहीं से तो वायरस आपका शरीर में आना चाहिए। और आपने मुझे प्री टेस्ट में, जब मैंने पहले दफ़ा आपने मिला, तब आपने बोला कि आपका कभी भी आपने सीरीज यूज़ नहीं किया, ड्रग भी यूज़ नहीं किया, ब्लड ट्रांसफ्यूजन आपने कभी नहीं किया किसी से, अभी तक करने का ज़रूरत नहीं पड़ा आपने बोला। तो एक ही रास्ता रह गया, वो है शारीरिक संपर्क का जरिए है आपका पास HIV आ सकता है। और आपका साथ लड़की का अगर रिलेशनशिप है नहीं, तो डेफिनेटली कुछ तो होगा। तो आप अगर बोलना चाहते हैं मुझे बोल सकते हैं, दिस इज़ वेरी कॉन्फिडेंशियल। मैं आपको ये एश्योरेंस देता हूँ कि ये घर का अंदर और ये जो भी डिस्कशन हो रहा है, आपका और मेरा पीछे हो।
तो शादी से पहले जब हॉस्टल में था ना,
अच्छा,
तो 2 बार संबंध हुए थे मेरे।
अच्छा,
मेल के साथ, जब वो पार्टनर था मेरा।
अच्छा, सही है। अभी उनको जान पहचान है आपका साथ उनका?
हाँ, जान पहचान है, लेकिन अभी कॉन्टैक्ट मेरे वैसे तो नहीं है, लेकिन उस टाइम में
है।
अच्छा,
तो अगर अभी देखिए आप अभी ट्रीटमेंट ले रहे हैं और वो भी अगर उसी से अगर आपके पास आया, तो उनको भी HIV हो सकता है, तो उनको टेस्ट करना भी ज़रूरी है। तो आप बुरा ना माने, तो हम लोग उसको, आप खुद उनका साथ बात कर सकते हैं, बात करके यहाँ पे समझा के लेके आ सकते हैं। दूसरा है, हम दोनों भी ट्राई कर सकते हैं, उनका साथ संबंध कनेक्ट करने का कोशिश कर सकते हैं। हाँ, सो हम दोनों भी उनको मिल सकते हैं, अगर आप परमिशन दे तो, आपका कंसेंट है तो हम लोग मिल सकते हैं उनको, और किसी ना किसी तरीके से समझा सकते हैं, उनको ला सकते हैं, टेस्ट कर सकते हैं, ठीक है। और चौथा चीज़ है, आप खुद अगर नहीं चाहता है, इस फील्ड में नहीं आना चाहता है, तो अगर मुझे कॉन्टैक्ट नंबर या कुछ देते हैं, एड्रेस देते हैं, तो मैं मेरे तरीके से भी कोशिश कर सकता हूँ। तो आपका क्या राय है इसमें?
मैं उसका कांटेक्ट नंबर आपको देता हूँ, सिर्फ उसको ये मत बताना कि मैंने उसका नंबर वगैरह आपको दिया है, उससे कुछ हो सकता है क्या?
अच्छा, कभी आपका उसका साथ कभी संबंध सही था या कभी झगड़ा उगड़ा हुआ था? आपका जो बॉयफ्रेंड हो, कुछ भी हो, जो आपने बोला, रिलेशन कैसा था आपका साथ? सही था?
हाँ सही था, मतलब झगड़ा वगड़ा तो कुछ नहीं है, लेकिन उसको मालूम नहीं कि मतलब क्या सिचुएशन
क्या सिचुएशन है। अच्छा, नहीं वो सही है, आपका स्टेटस हम लोग कभी भी नहीं कोशिश नहीं करेगा, डेफिनेटली विल ट्राई कि हम अगर आप नहीं चाहता है तो डेफिनेटली मैं कोशिश करूँगा कि मेरा तरफ से ही हो जाए, मैं उनको कांटेक्ट करूँ और ये इंश्योर करूँगा कि आपका कुछ भी इंफॉर्मेशन, आपका कुछ भी ये उनका साथ शेयर नहीं होगा, ये मेरे तरफ से आपको आश्वासन देता हूँ, ठीक है। तो मैं, अगर आप बुरा ना माने तो मुझे ये एड्रेस और पता आप यहाँ पे लिख देते तो मैं कांटेक्ट कर लूँगा, ठीक है। ठीक है।
Okay, you can upload the PPT. Divya ji? Okay. Okay, next slide, please. So there are certain comments also. So we have a case where it is given in written that in case of any disclosure of the status or further inquiry, the client shall commit the suicide, or all blame should be with the concerned counselor. How to deal with such PLHIV? So as I said earlier, this is all voluntary. So you cannot force anyone to engage into the index testing. It's all voluntary. If they want to, in the end of the day, if they are not at all willing to get engaged with you in terms of partner elicitation, you cannot force them. And if they are to a certain extent are engaging and having apprehensions in terms of revealing of their identity or disclosure status, you can give them enough confidence that by use of different methodology, that yes, your identity will be kept a secret while we try to reach out to the contacts through various means. So that confidence has to be built up, that yes, the whole process is confidential. The identity will, if ever the identity is revealed, it is only after the consent of the client that the identity can be revealed. If the client is not giving the consent to reveal the identity cannot be revealed. And there are different ways and means of reaching out to PLHIV while concealing the identity of such clients. So two things you have to remember about the ways and means to conceal the identity. Second is the voluntariness of this process for engagement. Second is about the second question is about my RT centers located in the population which have high risk group, IDUs, MSM. So majority of clients are of high risk group. How to offer the elicit such clients, trying very hard but with little success. So please understand, whoever have actually written this, that it is a very good thing that your ART center is located in the area which is having high risk groups. You must be having any of the TI settings which is located near to you. So seeking the help of the TI counselors, outreach worker, or peer educator is the best possible strategy. You should have ask your medical officer and the project manager of the concerned nearby TI to share the list of the eligible PLHIV where you need to reach out to the HRG population and seek the help of this outreach worker, peer educator, counselor in the TI setting for the partner elicitation, because HRG are in better coordination and close association with the TI settings are in better association with the HRG population. So they might be in a way to help you out to reach out to the clients of this uh, or the partners of this PLHIV. So the rule we'll come to the slides. The rules says the resist telling the client what to do. Do not order them. Be inclusive and understanding that it is not a directing, but it's more engaging the client in on one-to-one discussion. Understand motivation, barrier, challenges while notifying the partner. Listen them empathically and empower them to take the action while reaching out to their partners and the family or the family tree. Next. So this is a case study where this is a recent study actually of June 2024, where we have a male of 25-year-old. He had a partner or a spouse who is 22-year-old. While the male is PLHIV. He was mostly an MSM partner. It seems that he was an MSM partner, and he was HIV positive. When we tried to reach out to the spouse turned out to be HIV negative. But there are other partners also. I think there are 7 partners that he elicited. That he had 7 male partners also, and out of those 7 male partners, the 3 of the male partners were actually found to be HIV positive. While we reached out to them, and then the other part the 3 other male sexual partners who were found to be HIV positive, we try to reach out to the other sexual partners of those clients also, and the testing is actually happening. Reaching out to these clients of the newly identified partners are in process, and test results are actually awaited for this client. So you can see the first wave is of the center wave, where we try to find out the first degree wave of the clients of this central male who is 24-year-old. And then once we find the HIV positive client, the second wave of identifying the clients of these positive patients initiates. So this is a never ending process. Actually, this never ends. It's a long process, kind of unending process, where you can reach out to the partners of these HIV positive clients. Next, please. We have a pop-up quiz. I request Divya to please upload the quiz. So David is an MSM registered with the TI NGO. During a CBS camp, he was screened HIV reactive. Later, he was confirmed with HIV positive. The counselor offered him index testing, but David was scared to inform his spouse and his partner. So, what should the counselor do? What should the counselor do in terms of providing the index testing? There are I think four है कि ज़्यादा है. There are 5 answers. 1, 2, 3, 4, 5, and there are multiple choices. You can select multiple answers also at a point of time. So I am ending this poll now. we got quite some responses. We got around 200 responses. Five 5% did say that forced David to notify his partner, which I would ask these people to resist in doing such things. Please understand that it's a voluntary process. Don't force anyone to notify the cases. Actually, there is always a chance of intimate partner violence or other psychosocial issues. So please do not force anyone. Give 1 week medicine to David and ask to bring spouse. Per se, under the program, we are not having this policy of giving one week of medicine. We give them 1 month of medicine. So we can give them 1 month of medicine. Ask the to bring spouse testing for during the next visit. Better answer would be to give 1 month of medicine. Third one is stabilize divide on ART and then offer partner elicitation once again. Yes, he is newly identified with HIV positive. The first priority of the program is to stabilize them on ART. And once he is stabilized, then offer the partner elicitation. But please understand that about index testing, you have to notify, you have to make them understand immediately after the patient is found HIV positive. Once the patient is diagnosed with HIV positive, you have to make them understand that yes, index testing is a process where he will be engaged with in terms of partner elucidation. So to an extent possible, if it is possible to elicit the partner, try to engage with the client in this immediate settings where we give the post test counseling for the partner elucidation. And if the client is not in a condition to engage and give the or notify the partners, the first priority will be to link to the ART, stabilize the patient on ART, and then again initiate the process of partner elicitation. Third is explain the importance of early detection and treatment and convince David to pass the same message to his loved ones. Yes, absolutely. And most of the people have actually given the same response. And not follow up with the David anymore is per se is not the correct answer. You can give David some more time, some more, you can say, breathing space, to let him introspect, to let him understand what you have told him, and ask him that we will get back to you maybe after a certain point of time to again engage with you to understand your partners or notify the partner. So these are the possible ways where you can engage with this client named David, and not leave any opportunity of eliciting the partners from this patient. I am requesting for the next slide, please. So script is for partner elicitation is very very important. Yeah, not everyone is very fluent in terms of how to engage with the clients in terms of partner elicitation. Counselor per se have their forte in terms of having a dialogue with the client, but it might be new to many and challenging in the initial stages. So it is very important that you give a draft script to the counselor for engaging in partner elicitation. This is a please make sure that you use open-ended indirect method for partner registration while you give the script. And while the names are finalized, while partner registration, you can further ask the question about the risk patterns, like risk related to sexual transmission, condom use, violence, drug, alcohol use during the sex or before the sex, injecting practices, etc. So prime importance is about how you engage with the help of the script, and then partner elicitation. Next slide, please. So this is a draft script for the sexual partners. Uh, um, it is like how we will engage. The draft script is in. We are giving it to you in English. You can modify in your own regional languages for further circulation to the counselors. It goes like that. With your consent, I would like to discuss about your personal matters, because we would like to extend the benefits of HIV testing and treatment to your partners too. So, should we start the discussion? So, you are asking about the consent. So, after the client gives you consent, according to you, do you have the partners who had or have sex with you in the recent past? And if he tells that yes, there are partners who have had or are having sex with you in the current time also, can you please elaborate more about them? I will keep this information confidential, and I'm asking these in detail so that you can take a decision about partners who can benefit in terms of reaching out to providing testing and treatment. So while you seek the information, you make them understand, give them the confidence that the whole process is confidential. Try to ask the question about the gender of the sexual partners, the number of the partners, the nature of different relationships, sexual injection or maybe household, condom use patterns, barrier to use condom use, drug use patterns, etc. Are you aware that among these sexual partners who actually know their HIV status, who are actually on treatment? So you can screen out how many partners are actually on treatment, so that you do not reach out to those partners who are on treatment. So you need to reach out to the partner who actually don't know their HIV status, or not sure about their HIV status. Next slide, please. So this script is about the needle sharing partners. The open-ended question are like you get into discussion with the client, where you ask his consent to discuss about the personal habits and daily life, where you give him the confidence that this discussion will give him or empower him to take a decision about referring about the individuals who can benefit from HIV testing and treatment. And just don't directly get into injection drug use information. You can just uh, i- casually you can get in informal discussion about what do you have your earning, how do you earn the money, and how is your typical day, what is the source of income, how much is the income, sort of open-ended questions. And then coming slowly to the point of needle sharing practices, where you say that some people get into the habits of alcohol or drugs to relax or stay away from daily stressful life. So I would like to know if you have any such habits to de-stress yourself. Do you get to engage yourself into alcoholism, maybe drug use, so that we can again prod into deeper questions. So what kind of, you can elaborate more further, what kind of drug use do you have? Do you have alcohol? Do you have sex during alcohol? Do you have oral use? Do you have injectable use? What kind of injection practices do you have? Do you share the needle syringes? Do you remember how many people you have shared your needles and syringes? Do other people share the needles and syringes with you? So once they try to open up, you can prod slowly by slowly about the different practices of the drug use. And you can also prod about the sexual practices during or before or after the injection or drug use pattern, or maybe substance use. You can ask the information about the partners, the number of partners, behavior pattern, and the names, details, and also information of how many of them are actually aware of their HIV status. Get the information about how many of them actually are on treatment. And this information, with this information, you can close the discussion about giving enough confidence to that patient that the whole discussion has been confidential, and the process further on will be kept confidential, not to reveal the identity unless you give the desired consent. Next slide, please. So the script, we have also cases where the counselor tried to reach the client on a phone call. So on a phone call, you have to be even more careful in terms of who are you talking with. So you start with, I am XYZ as a counselor or healthcare provider at this ICDC ART center. Am I speaking with this at this patient? So if the patient is not available, then you prefer not to discuss the details with the person who is on the phone. You only speak to the concerned patient only, and try to hold on the talk by saying that thanks, I'll come back later when the particular patient is available. And if you find that yes, patient is on call, then uh, do have the conversation about sharing the information which is important for him or her, and ask the time whether that time is good enough for him to talk, because the discussion might be engaging and lengthy. So his engagement is important in terms of his time to talk to you. And if not, then what will be the better time for engagement in this important discussion? And before you start the actual discussion and sharing the actual information, be sure that the partner that you're talking to is actually, so it is like an IVR confirmation that may I know your date of birth, or may I know your home address. This information you can cull out from the index class, so that if the date of birth is known to the index class, you can confirm it with the date of birth or address. So if whatever information, if date of birth is not available, what is it, whatever information that is true to the partner is available from the index case, you can get that information from the index case and get it confirmed while you start the discussion with the partner. Next slide, please. So do not proceed the notification until you confirm the identity. Only when you confirm the identity based upon the feedback that you get from the patient on call, you start your discussion. You tell him that we have recently learned that you have may be exposed to HIV, and it is important for you that you come to this and this ICTC or maybe screening center, AIT center, for an HIV test so that you can learn your HIV status. And if you are HIV negative, we can give you the information which can keep you free from HIV in the rest of your life. And if you are found to be HIV positive, we can treat you with the medicines which are lifelong medicine, and these medicine reduce your chances of progressing the disease and passing the HIV to others. So this is the way you can have the phone call while confirming the identity of the person who you are talking to. Next. So you give them further information when and where, at what is the convenient time where you can access the service, and all those information, who can you communicate to, where to come, which hospital, which area of the hospital, what time. So what this all information you can give them, and then get schedule a visit for the partner to visit the facility. Or you may even if the client is not ready to come to the facility, give them an option of giving them the test in the area which is feasible to them, in the form of CBS, community based screening, or the home visit, or the common place or facility which is near to the client. Next. So in case the patient comes to the facility, you can do the, but in case he requests for a home visit or a visit nearer to the area where he is comfortable, he you introduce yourself as your name as XYZ, and I am looking for a person named this and this. Is he or she around in the home? So if he is not available, ask what will be the time when he or she will be available, or you can even schedule a home visit based upon the phone call, what that will be convenient to you. So once the person is available with you, you can again start with the same conversation, that you have an information that is important to you in terms of your exposure to the HIV, and it is important that you get tested for HIV because you had an exposure which puts you of risk of contracting the HIV infection. Give them the information about the preventive services if he is found HIV negative, and the treatment services that are available under the program to keep him safe and others also safe in case he is found HIV positive. Next, please. So you so based upon the time, the mutually convenient time, you visit the client, or give him option to come to the facility, provide pre-test post-test counseling, inform consent, and give the test result to the client accordingly. Next slide, please. So we have third video where you can engage with an IDU in terms of contact elicitation. Next.
जी, आप आ गए। 2-3 दफ़े फ़ोन किया था आपको मैंने, आप फ़ोन भी रिसीव नहीं किए, लेकिन लास्ट में आप आए, यही मेरे लिए बहुत बड़ा बात है, खुशी की बात है। और बताइए कैसा चल रहा है?
ठीक चल रहा है।
ठीक चल रहा है। आप वो गए थे ना, ART स्टार्ट हो गया ना आपका मेडिसिन?
हाँ, मेडिसिन स्टार्ट हो गया।
ट्रीटमेंट ले रहे हैं आप?
ट्रीटमेंट ले रहा हूँ।
बराबर है ना सब कुछ?
एकदम
कोई तकलीफ तो नहीं है?
कोई तकलीफ।
अच्छा, तो अभी अच्छा लग रहा होगा आपको?
अभी अच्छा लग रहा है पहले से।
अच्छा। तो वहाँ पे जो मैंने बोला था वो TI के बारे में बोला था, जहाँ से फ्री में नीडल सिरिंज।
नहीं, वहाँ पे नहीं जाना है।
सिरिंज जहाँ
नहीं जाना है।
नहीं जाना है? क्यों नहीं जाना है?
वो कुछ पहचान के लोग भी।
पहचान के लोग हैं, वो इसीलिए नहीं जाना है?
हाँ।
देखिए वो आपका मर्जी है, अगर आपको नहीं जाना है तो आपकी मर्जी है, मैं वहाँ पे आपको ज़बरदस्ती भी नहीं कर सकता हूँ, लेकिन यही है कि वहाँ जाने से आपको फ्री में सुई सिरिंज वगैरह मिल सकता है, इसीलिए मैं बोल रहा था कि वहाँ जाने से ठीक रहेगा। वैसे आप जो इंजेक्ट करते हैं आपको फ्री में, आपको मैनेज कर लेते हो आप, डेली नया सुई सिरिंज मिल जाता है आपको?
कभी कभी मिल जाता है।
और दूसरे दिन क्या करते हो फिर आप?
कुछ है मेरे पार्टनर्स।
पार्टनर्स से सुई सिरिंज लेते हो?
हाँ, सिरिंज
मतलब उनका शेयर करते हो क्या आप?
कभी कभी शेयर करते हैं।
कितना पार्टनर्स होगा आपका ऐसा?
तो
दो तीन होगा? दो ही है जिसके साथ शेयर करते हो? उनका HIV टेस्ट हुआ, आपको मालूम है?
नहीं ना, तो नहीं
मालूम नहीं है?
नहीं मालूम।
तो उनको भी तो लाना है ना HIV टेस्टिंग के लिए। मान लीजिए अगर उनको भी HIV है, भगवान ना करे उनका HIV हो, लेकिन अगर है तो उनको भी तो ट्रीटमेंट चालू करना है, ताकि आपकी तरह वो भी ट्रीटमेंट स्टार्ट कर सके, अच्छा रह सके, हेल्दी रह सके। आपको मालूम है ट्रीटमेंट से कितना मतलब फ़र्क पड़ता है ना? तो उनको भी बुला लीजिए टेस्ट करने के लिए। आप बुला सकते हैं उनको, आएगा आप बुलाने से, या फिर आपको क्या लगता है कि आप अगर बोलेंगे तो
नहीं,
आ
आप मत उनसे कुछ कॉन्टेक्ट करें, मैं लेके आऊँगा उनको।
आप लेके आओ?
मैं लेके आऊँ।
ठीक है। देखिए आप कोशिश कीजिए लाने के लिए, ठीक है? अगर नहीं होता है फिर हम लोग फिर डिस्कस कर सकते हैं। अगर वो आपसे के कहने से भी अगर नहीं आते हैं ना, तो हम लोग फिर प्लान कर सकते हैं कि फिर कैसा लाना है उनको, ठीक है? लेकिन आपका सहमति से ही होगा, जो भी होगा आपका सहमति से ही होगा। ठीक है। और उनके साथ आपका रिलेशन कैसा है? ठीक है, कोई लड़ाई झगड़ा नहीं होता है?
कोई प्रॉब्लम।
अच्छा। और आपने बोला था मेरे को, ये भी बोला था आप शादीशुदा भी है?
हाँ, शादीशुदा।
तो वाइफ का तो टेस्ट नहीं हो रहा होगा? बीबी का टेस्ट हुआ HIV का?
नहीं, उसको मैंने
बताया नहीं, उनको स्टेटस भी मालूम नहीं है आपको, ठीक है? उनको भी तो टेस्ट कराना है ना। क्या करें, उनको कैसा लाए?
नहीं, अभी तो बात छोड़ दीजिए वो।
मैं जाऊँ उनके साथ?
नहीं, बिल्कुल नहीं।
आप ला सकते हैं
वो बात नहीं मतलब
ठीक है,
वो आप
ठीक है।
मत पूछो।
ठीक है, अगर आप नहीं चाहते हैं तो उनको अभी हम नहीं लाते हैं, बाद में देख लेंगे, ठीक है? आप अभी आराम से रहिए, आपको बोलने का ज़रूरत नहीं है, आप अपना दवा बराबर लेते रहिए। और जैसा मैंने बोला कि अनप्रोटेक्टेड सेक्स बिल्कुल नहीं होना चाहिए, ठीक है? उससे भी उनका ट्रांसमिशन हो सकता है, जैसे मैंने आपको समझाया था, ठीक है? लेकिन बाद में हम लोग देखेंगे, क्योंकि उनको भी तो टेस्ट करवाना है। अगर नेगेटिव है तो बहुत अच्छी बात है, अगर पॉजिटिव है तो उनका भी ट्रीटमेंट चालू करना है। नेगेटिव अगर है तो उनको नेगेटिव कैसा रहना है ये भी आप दोनों को बताएंगे, है ना? तो अभी ठीक है, अभी हम नहीं बोलते हैं क्योंकि प्रॉब्लम हो सकता है ना, आप जैसे बोल रहे हो, है ना? ठीक है, नहीं बोलेंगे उसको, ठीक है? और ये देखिए, मैं एक बात बताता हूँ आपको। हाँ, कभी कभी क्या होता है ना, अगर आपका वाइफ होने के बावजूद भी बाहर में भी कभी कभी हम लोग रिलेशनशिप बना लेते हैं। जैसे कि हो सकता है कि शादीशुदा है, लेकिन शादीशुदा होने के बावजूद भी कोई दूसरा औरत के साथ भी रिलेशन हो जाता है कभी। मैं नहीं बोल रहा हूँ कि आपका ऐसा कोई है, लेकिन हो भी सकता है। अगर है तो वो भी आप मेरे को बता सकते हैं, क्या कोई ऐसा
है? एक है।
कौन है, मतलब कैसा है?
मतलब ड्रग पार्टनर है।
वो भी ड्रग लेती है?
हाँ,
वो भी ड्रग लेती है। और आपके साथ सेक्सुअल शारीरिक संपर्क भी?
हाँ, कभी कभी हो जाता है शायद।
कभी कभी हो जाता है। तो उनका क्या करें? उनको भी तो टेस्ट करवाने के लिए लेके आना चाहिए ना?
हाँ, तो उसको भी मैं लेके आऊँगा।
आप लेके आओगे?
आऊँगा।
तो आप तीनों को ही लेके आओगे?
हाँ।
पहले जो दो आप इसी नीडल सिरिंज जिसके साथ शेयर करते हैं उनको भी लेके आओगे, और ये जो आपके साथ जो शारीरिक संपर्क है जो
मैं ही लेके आऊँगा।
आप नहीं लेके आएंगे, ठीक है? तो फिर एक काम करते हैं ना, इनके साथ आपका रिलेशन सभी के साथ अच्छा है? कोई प्रॉब्लम नहीं है?
कुछ
काम
काम
करता
करता
है
है उनको लेके आऊँ।
आपको मैं 14-15 दिन का टाइम देता हूँ। 14-15 दिन में आप ला सकते हो क्या इनको?
हाँ, ला सकता हूँ मैं।
ठीक है। अगर बाई चांस ये 14-15 दिन में अगर नहीं लाते हैं आप, हम लोग एक काम करते हैं, फिर से मिल के प्लान करते हैं कि ये नहीं आ रहा है या कोई कारण से अगर नहीं आ रहा तो फिर कैसे करके इनको लाएं, क्योंकि उनको भी अपना स्टेटस जानना ज़रूरी है, उनको भी जांच करवाना ज़रूरी है ना?
हाँ।
तो आपको मैं आज कितना तारीख हो गया? आज मान लो
आज 18 तारीख है।
18 तारीख है ना? नेक्स्ट महीना का मतलब अगस्त का 1-2 तारीख तक आप लेके आओ उनको, ठीक है? हो जाएगा ना?
हाँ, हो जाएगा।
अगर नहीं हुआ तो फिर हम लोग बैठ के फिर प्लान करेंगे, ठीक है? फिर हम लोग लाएंगे, ठीक है? ओके, थैंक यू।
Okay, Shweta, if you can upload the PPT.
Yes, sir. Give us 2 seconds, please.
Yeah. Okay. So you have seen in the video, okay, that Shweta, if you can upload the PPT.
Yes, sir.
Praveen sir,
Give us
there's
two
again
seconds,
audio
please.
problem.
There is again an audio problem. Yeah. Okay. So
Sir, please continue.
okay, thank you. So you have seen, yeah, IDUs are difficult to engage into the program in terms of ART, adherence, and all sort of issues you have seen. And partner elicitation is even challenging. But yes, counseling. Here you have seen the type of method that was used was contract referral. The client and the provider engages in terms of intercession, and they had a contract with each other in terms of the provider giving time of around 15 days or so for the partner to for the client to reach out to the partner and bring them to the center. So there are different ways to reach out to this strategy. So this is the last slide. This is actually again a case study which was done in Andhra Pradesh, where it was done from November 2020 to March 2023. This case study was a case study of 2.5 years, where we have identified that. Um, just a minute. The case started with one index case that was identified in the month of November 2020, where we tried to reach out to the partners, different partners, through counseling sessions. We tried to reach out to their spouse, to their other sexual partners, other sexual or nurturing partners, biological children, biological mother, biological father. So there, these were different stages. Starts with one PL HIV, and with this case, which lasted around 2.5 years, we were able to identify almost 101 contacts with the help of one single PLHIV. One single PLHIV gave rise to, you can see in the topmost quadrant, left quadrant, one PLHIV gave rise to maybe 4 to 5 contacts, and then reaching out to further contacts gave rise to different other chain. And with this, we were able to identify 101 contacts of different PLHIV. And then upon the testing, we tested for around 96 cases out of this one contacts, and we have identified 38 positives. So this was a case study that is motivation for every one of us, that we were talking in the beginning also. This the camp is a short-lived camp with a limited shelf life, for us to onboard everyone, make us understand in details in a campaign based approach of how to implement the strategy. This is actually a takeoff, principally a takeoff of the index testing strategy under the NSAP, National AIDS Control Program Phase 5. So this is actually a, you can say, game changing strategy, which is not new, which has been implemented. We need to implement in a more consistent, in a more regulated fashion, so that wave continues a year on year, PLHIV on PLHIV by our counselors, to identify the cases on case to case basis. So this is all from my side. I think I had one question from YouTube, whether there was a case where there was a mother who had 2 children, while the case was. Uh, yeah, I request Divya, if you can display the question.
Sir, just sharing the screen.
Yeah.
So there are
is
two
visible.
questions, one from YouTube and one from the chat box.
Okay, the Sunita is on ART. Her two siblings were siblings. Okay, her two siblings were tested HIV negative at the age of 18 months of age. Now these siblings are 6 and 8 years of age. Do they need to be tested again at another testing campaign, sir? See, under the early infant diagnosis modality, the last confirmatory testing is to be done when the patient is have stopped breastfeeding, and testing has been done after 3 months of stopping of the breastfeeding. If this at the 18 months of age, if the patient was still breastfeeding or he have not completed 3 months of the breastfeeding at 18 months of age, then repeat testing has to be undertaken. And if breastfeeding have stopped 3 months prior to the 18 months testing, you need not engage them in the index testing campaign, as they are out of risk of contracting HIV. Second, if the index partner are tested in private labs, there is no provision in source to register info. How to consider such cases? You need to consider such cases as new cases, register in SOCH, test them for HIV, confirm the HIV positive status, and then link to the ART with the ID that is generated in the ICDC module. Any other question that we have?
I request
we
all the
had two in the
participants
chat
if they have
box.
any questions. So there is a request that it is requested to kindly show some counseling session video of a reluctant PLHIV.
Okay, as of now, we have 3 videos and the time is limited, but we make sure that while we share all this content with you all for further down training, we will make some couple of videos on reluctant PLHIV also, who is reluctant to engage themselves in the counseling section. We can call them as a difficult PLHIV for providing the index testing services. We will make this a point to share with you this reluctant this videos also. So I think that was all from my end to give you. We will share this PPT, we will share this write-up, we will share the script, we will share these videos with all of you for further down training. We'll share if any more videos are available with us for further dissemination. So
So there
We
is
have
one
one more
question. If the patient is tested negative in a private, this is already.
you have to test them in the ICTC for again engaging into
We
the
have
service.
two participants who have raised their hands. Do we have any questions?
Yes, sir. Good afternoon, sir.
Yes,
Sir,
madam.
sir, we have a patient couple. Both are positive and both are registered in ART. One husband is going to UK for some work. So how we track him to ART, or we have to erase him from our data? What to do with that patient, sir? He is on ART.
See, this is not pertinent to this session. You can take this issue with CST division of your
Okay.
state.
Okay, sir. Okay, sir. Okay, sir.
Okay. So if you don't have any question, we can formally close this session. And I, on behalf of NACO, thank you everyone for joining this session. We have more than 400 participants who have joined this session, and more than 350 were consistently were the part of this discussion. So glad to have you all here. I hope I tried to convey what we wanted to convey, and we expect that you will be taking the down training sessions of your staff also. So thank you from our end. Goodbye.
Thank you, sir.
Thank you very
Thank
much.
you, sir.